welcome to the second in our ACDI series of thought leadership presentations on climate and development. And we are very happy to welcome today Dr. Amy Weimann and Professor Susan Parnell. Amy is at African Centre for Cities, which is at UCT, where she is the lead research on the Mali program, which I hope we'll hear a little bit about today. So I'll leave you hanging as what Mali stands for. And she did her PhD in public health here at UCT, and she works on supporting healthy cities development, policy uptake and transfer, and she's focused on data systems relevant for urban health. So really excited to hear what you have to share today. And Sue Parnell, many of us know well. She was a professor here at UCT in the Environmental and Geographical Science Department. She is now a professor at the School of Geography at the University of Bristol, but she is still an emeritus professor at ACC. And she's had many visiting fellowships, and we won't go into those, but she has been really important globally in thinking about urban data, urban SDGs, connecting. She was the reason I got involved as a more climate environment geographer in the urban space. So really good to have you here sharing that. And she is part of the UCT Bristol collaboration agreements, which is why she's here for a few months. So really good to be hearing from you while you are here. Look forward to it. Thanks, both of you.
Thanks, everybody, and hello to the other people who are online. It's such a sophisticated room. You have this people and those people. So, yeah, it's really nice. The work we're going to be presenting is not so much a paper as an effort to try and draw together some of the work that Amy and somebody called James Germany, who also has a UCT pedigree but is based at the University of Bristol, and I've been doing. And you'll see I'm going to make the case that it fits into a much wider intellectual journey about urban health in a way that I think the core message of the day is, and Nick and I were having our pre-meeting discussion about whether this is an apposite moment to be thinking new, afresh, more robustly, more aggressively about the health, urban, climate interface, that nexus. And if so, effectively how? Because part of what you'll see on the slide, and they're as small as they are, so you can follow the links if you are looking at these slides later on, is that it's not new to talk about urban health. Okay, nobody, whether you go back to kind of John Snow and cholera, or whether you go back even further than that, the very obvious relationship between health and well-being, the way cities are organized, how they're run, how they're designed, it's not new knowledge. Huh? We know about it. We know new things about it. We know new things about vectors of disease. We know new things about density. We have different ways of thinking about it, but this is not new. It's an established link, but it is a link which has evolved over time. Okay, the way that that relationship is understood, the way that that pairing takes place is different now from what it was 10, 20, 40, 100 years ago. And that's really quite important, because when you seek to make an intervention, you're making it in a particular intellectual and a political context, yeah? And the subtext of what we're saying to you at the moment is this is potentially really good, and it's potentially really useful and relatively easy to engage the urban African climate question. And the reason for that is that the health professionals, I don't know how many health trained people other than Amy are in the rooms, but medics tend to have a very particular, very dogmatic, a very robust, two sides of the same coin, way of seeing things. And the problem is that when the medics have a very biomedical understanding of disease and of well-being, it's very difficult to articulate anything else. Okay, so even fundamentally obvious things you would think, like, water quality is quite important, are quite difficult messages to land when you're talking about things like the health budget. Okay, no, this is ours. We'll get a solution to diarrhea. We will not change the way the sanitation system in the city is run. So the fact that there was been such a shift in the way that medics think about space, about the physical and built environment is really important. And some of that is because everybody in the room familiar with the idea of the social determinants of health? Yeah. Okay. So what the social determinants of health did was to open up this idea that actually who you are, what your postcode was fundamentally important, as much as your genetic code. But that's become that is now much wider than that. And so ideas of planetary health or of One Health, again, I think probably very familiar to lots of people, but to state the obvious, the fact that those ideas are now so pervasive within schools of public health, within even the sort of wider health policy making is really important, because One Health, the idea that zoonotic diseases are not unconnected to the experiences of humans, that there is a single ecological system within which all disease and disease vectors operate, the idea of planetary health, this idea that there are scales across which disease travels, but also that there are interconnections which go across and are interdisciplinary, intersectoral, is really, really profoundly shaping, and it levels the playing fields in a way that is made possible a much more potent intervention by social scientists in particular. And for urbanists, it's been helped by the fact that there are parallel concepts like planetary urbanism, like complex systems. Okay, so those sorts of coming together philosophically. It's not a perfect match. You'll hear us talking later about some of those real difficulties when you start getting down into the data, begin to open up opportunities. Having said that, the blue on the screen says this journey through different traditions, intellectual traditions of urban health thinking has not been fabulously easy for Africans, okay? Partly because we haven't known enough quite often about some of the dynamics, partly because there hasn't been an evidence base. And if you don't have an evidence base in medicine, you can't publish. And if you can't publish, it doesn't exist as knowledge. So there's some real problems from an urban health perspective, from an African urban health perspective. And you'll see that very like the urban literature, for those of you who are urbanists will know that there's a sort of tradition of writing about cities which highlights the fact that there are ideas from other places that get dumped, not always very successfully, into urban contexts. And that's happened to some extent in the context of urban health. If you want to follow that, and if you want a single really good example of that, I've just put Warren Smith from the ACC Google Scholar page there, because Warren is actually one of the people who has documented that very clearly, very well, both conceptually, but also with some really good case studies and examples. And I think that gives you some sense of where the Africa urban health question lies. And that's important, because if you're going to take the argument, which we're going to make now, that this health process has changed in ways that open up opportunities for climate work to be integrated, mainstreamed into the urban health work, you do need to understand that. So the work we're doing today comes out of quite a long tradition of UCT's involvement in big global urban health debates. And I'm going to track a little bit of that same time very briefly so that you get some sense of it. But if you're interested in this stuff, and if you're interested in when and where and why climate does not feature, this is the stuff on the urban health trajectory that is really useful to know. So obviously, the WHO and how the WHO thinks is really fundamental. And there is this history which we'll draw on right away in our work, which pulls that through. The point about the WHO urban work is that it goes beyond obvious climate relevance in terms of projects like air pollution. Now, the ACC, Warren, myself, were involved in some of their early Ghana work on air pollution, but we've also been involved in some of their conceptual thinking, which Amy's going to pick up on in a little while. They are nominally interested in the link between health and climate change, but how that lands in a governance configuration is something that until recently has not been especially well thought through. And some of that is because the urban governance literature has not been focused on questions of health. That reflects a much wider disconnect, which sort of comes from the 2030 SDG problem. If you look at the SDGs, SDG 3 and SDG 11, they don't talk to each other. Okay, there is no link, the data doesn't overlap, the communities don't overlap, and so it's been really difficult to try and pull those things together. It's particularly difficult because health departments are often national, not local. Okay, and WHO typically engages with national health departments, and so some of the work that Amy and I and James have been involved with is for us really interesting because it's trying to bring United Councils of Local Government and the WHO together around SDG reporting, okay, around questions of urban governance. So all of that is to say that there are changes afoot. There are much bigger changes afoot. Institutions like the International Science Council have been really good about trying to forge discussions around urban data, around health data, and we'll pick up on that. I'm not going to go on for too much longer because I'm actually going to hand over to Amy because we'll otherwise run very short of time, other than to say that to try and listen to what we're saying in the next 20 minutes or so, partly because I suppose the proposition, if you like, is that if you're going to bring health, climate, and cities together, you have to do so substantively. Okay, in other words, it's not just, oh, these things are connected. Air pollution is linked to density. We know that. Okay. The question then is how, and how do you begin to identify the pathways to change? And some of what we're suggesting here is that it's actually within the governance community that being a little bit more specific about those levers of change, those institutional mechanisms, helps you to understand what can and cannot be done. So, Amy, over to you, and we'll talk both in some of the framework work we've done and then into some of the case studies, and then hopefully there's some time for questions.
Thank you. Good afternoon, everyone. Thank you so much for coming. Hi, everyone online. So, yeah, I think I can just start us off by diving into sort of this framework that we're going to be speaking about. But essentially, the first important thing is to say that cities and local governments are so important for actually establishing change for healthy and sustainable cities. Of course, it has to be at the local level that things get done, but they cannot operate in isolation. It has to be with support. And one of the ways to do this is looking at what the role government, national government can play in strengthening the means of implementation for local actors. And so that's the heart behind this framework. We had been going through a whole range of sort of key components and elements, and we realized that there were these four main sort of ones within the center of the circle that really speak to your key themes or elements that need to be strengthened and supported in order to maximize the ability for local governments to carry out their implementation. Not to say that local governments cannot do it without all these aspects. I think there's a lot of innovation that has taken place when there hasn't been support from national government, and there's one or two examples that I'll show now. But these are the sort of elements that we've landed on, and I'll take you through the framework now. But just to mention that there are these four cross-cutting arrows, just to draw your attention, that an understanding that for any urban health considerations, you need to understand that there will be multiple urban sectors at play. And in addition to this, there'll be multiple urban actors, which might occur at multiple different levels and scales. So it's quite a complex mechanism. And you might not only just want to focus on one disease or issue or urban health issue, but you have to understand how it's related to various different factors. And one disease might also be linked to other diseases. So there is complexity even on that front. And then on top of this, you have multiple urban health issues that might need to be cross-referenced. I know I've probably scared you, but it's just to be very aware that there are systems within systems that need to be looked at and try to understand. And that's why it's so important to come with a little bit of a sober understanding that various different groups and actors need to come together, and it will be messy in every context and situation, but you need to understand, and especially local actors will be best placed to understand some of those intricacies that happen at that local level, but national governments need to understand that that needs to happen at that local level. So starting in the top quadrant, we'll speak about data and evidence. This quadrant speaks to the fact that we need to make sure that we measure the right thing at the right scale and with the appropriate definitions. And this is something that we have been a little bit more aware of through our Mali work. So Mali is the African Mayoral Leadership Initiative, and mayoral refers to the mayors, city leaders. Often friends are like, is it mayors or males? And I'm like, no, it's mayoral, African Mayoral Leadership Initiative. So we have a cohort of about 15 mayors that join every year. And our research lab does a couple of research supports sort of work for them. But one of the things is putting together city profiles on all our cities, trying to access available data. And it's been very interesting to see that even different countries have different definitions of certain indicators, and the data just doesn't work together very nicely all the time. So this is something I'm very passionate about. So not to spend too much more time on it, but this quadrant also speaks to the need to have urban observatories that are interoperable with health data, and also the ability to even monitor and report on progress. So when you have urban health interventions, can you actually measure the progress that you're wanting? Is that data available, or do your local actors actually have to develop data themselves? Foster academic analysis. Can you work alongside academic institutions who will be able to bear the brunt of a lot of the academic analysis, like understanding the shifting burden of disease and some of those very complex urban systems within systems? And then other conversations like data governance, IP protection, and public access to data, which I know we've had little discussions about that. We know the challenges around accessing like health data for urban contexts. So another quadrant is resources. Now, I won't spend too much time on this. We all understand that local actors need resources to get things done. How they acquire resources might be different in various contexts. There are some really smart ways to do it. There's also human resources that come into play. Are you able to gain access to key experts who are able to provide that skill and resource and information? And then it's also institutional resources. What sort of cross-sector mechanisms are available that you can tap into? What is it currently existing and that you can enhance? And this speaks a little bit to your scaling up innovation and institutional reform quadrant, which deals with things like, do you have a political champion who can help drive momentum from within a government context? And this could be at either national or local level. Administrative reform speaks to, can you make the legal, fiscal, and institutional systems actually work for what you're wanting it to drive, like urban health projects? And this also speaks to supporting technical innovations. And then strategic planning is having a very smart vision. And Freetown is a good example, which we'll get to now, where they have a collected, united vision that is driving a lot of the work from within government. And then finally, the role of partners, participation, and knowledge. So this is around knowledge sharing, peer-to-peer learning. Are local governments and local actors tapped into wider networks that also link to resources a lot of the time? But what is that available? And are national governments sort of supporting these opening up and strengthening these at a local level? So we have developed this framework. It was for some of the work that the WHO had asked us to support and assist with, and contributed to these 4 policy briefs, which are part of the rollout of WHO's developing guidance on the urban health agenda at a national and subnational level. So if you do want to have a look at the policy briefs, the WHO have got these on their website under the urban health unit. So it speaks to those 4 quadrants. And because I've given a little bit of an overview, I don't have to spend too much more time on this, but it does just show a little bit of that thinking that went forward into this process. So we looked at that framework within the context of age-friendly cities as an example. And one of the things that we realized is that this framework obviously can be looked or can be used to help make sense of various urban health questions. And one of them we can look at is the nexus between climate and urban health. So can the framework be used to look at very messy, complicated efforts that have currently been going on? And we are going to be looking at Accra, Ghana. So this, as Sue mentioned, is based on some of the work that Sue and Warren have very, well, probably not recently, a while ago, been involved in. Yeah, so there is a report. There is a couple of reports available if you do want to read more about the whole Accra and Ghana air pollution initiatives. But there was a lot that has gone on there. And essentially, just to start off, it's very important to specify what's going on in the urban space. There is a lot of urbanization happening in Accra, and the city is expanding rapidly, which means that there is a large pressure on infrastructure and service provision. And as a result, the former mayor of Accra was just saying how there is a large number of factors contributing to air pollution, but 2 of them he identified as being open waste burning and road vehicle congestion, which is contributing to vehicle emissions. And this is obviously one of the other contributions is the sort of dust that gets blown off the desert in the dry months. So there are other factors, but these are ones that sort of can be addressed. So air pollution in Ghana was identified as a key risk factor for a variety of health issues, such as lower respiratory infections and heart disease. And in the 2021 Global Burden of Disease report, Ghana ranked air pollution as the 2nd leading risk factor driving death and disability across all ages. And this was above your your water sanitation and hygiene, above your high blood pressure, and also ranked above your high body mass index as a risk factor. So this was really, really eye-opening. And so I'm going to take us through the case of Ghana, but looking through the lens of this framework to make sense of examples of like what has been tried and done at that local level. The case of Ghana is quite interesting because they relied heavily on the use of data to drive home the point that you have to have air quality initiatives based on these sort of health outcomes that were being realized. And data and information was being used to also describe current trajectories in terms of health, economic, and environmental impacts. And this led to the health sector also being involved in assessing the various potential health gains that the health sector can experience from various policy scenarios. And this was all used to inform the action plans and really drive sort of a coalition of willing people. And then University of Ghana was also very much involved in this. There was a lot of research being developed on looking at various approaches that might be most beneficial. And researchers established that tackling air pollution required multiple approaches all at once. The traffic congestion, dealing with cooking fuels, burning of the waste, and industry emissions were the key sort of approaches that need to be tackled. And with this, realizing also that information and knowledge sharing had to be beyond just experts and policymakers. It had to go to the communities too. So finding ways to get communities involved in the knowledge sharing, particularly through media, this was also really important because it drives advocacy, and when people on the ground are very much understanding of what the government is trying to do and what the goals are, they're a lot more willing for that to happen. So regarding resources, some examples was that, of course, there was a lot of international agencies, a lot of international support funding-wise, which also not only drove financial resources, but strategic support. And budget was also able to be maneuvered because one of the ways in which national government sort of constructed its policy reform was to bring in the Ministry of Finance, and that allowed for a lot of budget to be maneuvered, as well as getting your air quality and climate issues onto your national planning processes, such as the National Medium-Term Plan. Local governments then played a really important role in just freeing up human resources on the ground, raising public interest, mobilizing grassroots support and awareness campaigns. And then with the help of the Ghanaian Environmental Protection Agency, things like even just getting equipment was a form of resource that was able to be used really well in the case of data, which is part of the other quadrant. And so these quadrants do speak to each other, so it's not always very easy to put things within the quadrants, but data capturing through air quality stations. And then scaling up innovation and reform, Ghana established a sort of a coordinating mechanism where there was a short-lived climate pollutants task force team. And this brought together a range of ministries. As I've mentioned, finance was one of this, but also local governments. And so you had a multi-scalar coordination group that actually assisted in implementing a lot of action at the local level. And there was other things like establishing plans for Accra, so actually putting it into policy and plans, which allowed for local action to take place in a better way, because now they've actually had national support in developing plans. And Accra also did a really interesting thing by publicly declaring that they'll be attaining to the WHO air quality guidelines. And so this put a lot of pressure to act out and to actually seek those outcomes. And so this shifted institutional and policy direction into a more clearer way that affected a lot more sectors. And then also just to say the local health sector was also mobilized through the WHO's campaign and just to help have a little bit more of a stronger influence over educating patients and doctors and healthcare workers about the importance of air pollution. And then finally, I won't spend too much time on this, but partnerships, of course, were very important in mobilizing resources, but also partnering with universities and grassroots movements. Urban Better Citizens for Clean Air, they do a lot of advocacy work on the ground where they get community members a part of their campaign to run through as part of physical activity through the cities with air quality sensors, and that information goes to the local government to just understand what's going on at a local level. So that's Ghana. What this basically I want to show is that this type of framework can help maybe just distill and gain a little bit of sense into a very complex and messy process of trying to outwork an air pollution type approach. And we'll see Freetown. I've tried a similar thing with Freetown based on looking at the heat issues that Freetown are experiencing. They've also come at it at different approaches, different ways. It's not a timeline of events like with the Ghana one, but it just helps just give some examples of what has been at work and at play. So with the Freetown example, it's important to specify the lessons that have been learned. So coming off the back of the 2014 to 2016 Ebola virus outbreak, there were a lot of hard lessons that Freetown has said they've had to learn around the keeping of up-to-date data and information, as well as mapping the location of informal settlements, as well as other areas across their city. And this proved to be very important in the response even to COVID-19. So through these, it actually has allowed them to improve their GPS tracking, their mapping systems, their data. And I think they are very well positioned to tackle future challenges around health. One of the other things to mention is that they have a strong link with their communities. The community members were involved in a lot of the data capturing. And I think this could be possibly because they had to do it so quickly at a local level. And so the community members are very used to being a part of these systems. So that does make like a local program of urban health a little bit easier when you can get community support in data capturing and advocacy work. So the thing I wanted to focus on, so Freetown has had extensive deforestation, and a lot of this has been as a result of your fast development, people moving. There's a high density within the city. 13,000 people per kilometer squared is the official statistic of Sierra Leone, which is crazy. So it's very, very busy. And it's sandwiched between the coastline and the mountains. So there really is no place to expand too far. And so deforestation has made the area very vulnerable to landslides and has really created a challenging urban heat island effect for the city. And this has multiple health issues. And not only do you have an increase in your vector-borne diseases linked with malaria and mosquitoes, but you also have other sort of health issues at play because of that. So again, just to remind you of the 4 quadrants, we're going to start in a different zone. I've just popped this up at the top there so you know where we are. But institutional reform, I'm starting here because I think this was probably one of the things that helped drive the process better for them. The first is, as I mentioned, coming off the back of COVID and Ebola, Sierra Leone with WHO launched this Universal Health Preparedness Review. And essentially what it does, it strengthened the national emergency response, but it allowed, therefore, the local government's response to be freed up a little bit more. And it did not shift the response solely onto the health sector, but rather did a whole of society approach to strengthening local participation for any future national emergency readiness. So it created a whole of society approach that was pretty much ripe for the taking for any urban health initiative, right? Because urban health needs multiple sectors at play. And so with this, Freetown's institutional and policy reform, you can say, they managed to, off the back of this, develop what is called the Transform Freetown Plan, where they reconfigured their local government into 11 priority sectors, and it's across, so 4 clusters and a total of 11 sectors within that. Cluster 1 is resilience, cluster 2 is human development, 3 is a healthy city, and 4 is urban mobility. And this, I mean, health is already there, which is great. And then through that, also Freetown established their very first climate action strategy. And off the back of these 2, Freetown was also able to roll out their Freetown the Tree Town campaign or initiative, which is incredibly ambitious, but they have achieved their 1 million trees planted by 2024, which is amazing. And they are now trying to establish a goal of 5 million by 2030, yeah. So this was actually incredible and a very promising story, which we'll get into a bit later. But they did combine a range of policy approaches to address heat through not only greening the city through tree planting, but providing cooling architecture, improving pedestrian shading and other mechanisms. But it wasn't easy. Obviously, there's a lot of moving parts at play. The role of data, as I mentioned, was also really important. Having learned lessons from COVID, they were now able to map things really easily. So they have developed a whole lot of heat island maps for their city. So I've just pulled this off their website just to show they've mapped it from 1988 to 2018, and they're continuing to do this at a ward level within the city. And they've also partnered quite a lot with your local government volunteers. So you have volunteers riding around on motorcycles with heat sensors on their bikes going around taking readings. So they've been really innovative with partnering with local communities to capture this data and information. And then another thing to mention is that Freetown the Tree Town, the city residents are the ones who at work planting the trees. So they are paid to plant trees, and the whole process is monitored through an app where if you choose, or you have a tree, you plant, you capture it via this app. And as soon as you capture the full tree, proving that it has been planted and it's growing, you get paid through little tokens. And what this also does is it allows for trees to be monitored over time, because with your trees, you have to go back and keep recording that it is still growing. If it's still growing, you still get paid. So it's a way in which you can monitor the health of the trees, make sure they're growing. It's not just plant and hope for the best. So it's a really lovely example of, yeah, it's just really smart ways of using data and information, but partnerships with communities. So I've also linked this here because this is where sometimes the quadrants do overlap. So partnerships with communities were crucial. The Freetown initiative was actually co-designed with community members itself. So that also does help. And the official, given the shortage of official data from weather stations, local governments were also able to mobilize the communities in collecting this data, as I mentioned, through the motorcycles, and that was really helpful. Then on to resources, this is just an example now of like a human resource, if I can say that. So in the picture, you have the mayor, the current mayor of Freetown, and then you have the Freetown's first heat officer. So she's actually been employed as a chief heat officer, and she's overseeing the implementation of several strategies to mitigate heat. As I mentioned, it's relating to providing shade, developing greening spaces, but also overseeing the Freetown initiative. This has just been they've just been acknowledged in National Geographic number 33. So if you do want to have a look at that story, you are welcome to. And then the financial resources have been mobilized or are being tried to be mobilized at the moment. I don't know the progress of how this has been done, but the city is starting to mobilize its own funding through selling the carbon offset tokens, which were the tokens that people get paid for if they plant the tree and capture it. And they are hoping that this will start covering a lot of their costs. What has also happened is with partnerships with philanthropies and other international agencies, they've been able to get resources for actual purchasing of the trees, because that is quite expensive, but also tree donations have come in. So those are very two high-level examples. I know it's pretty much we're at the end of our time before questions, but just to say, like, yeah, the idea of these two case studies was just to show that this is a messy field. This is going to be messy, but there are different ways in which you can figure out how to get things done at local levels through innovation and smart ways of doing things, but also learning from other cities that have done things well. And yeah, we just like this quote, broader than traditional public health, urban health embraces the many sectors, actors, actions at multiple scales that influence the health and well-being of urban dwellers. And this really does also understand that it's embedded within broader systems like ecological systems. And I just thought we'd end that there. So let me know if there's anything else you wanted to mention before. But if you want to find out more, there's some more links here. If you would like to join our Africa Urban Health Community of Practice, that is a link there if you want to just be a part of a broader network of urban health people.
Sue and Amy, are you happy to manage the question?
Sure.
And then can I just ask, if you do have a question online, you can just put your hands up and we will get to you as best as we can. But if there are any questions in the room.
1, 2, 3. Why don't we start on?
Thanks, guys. That was really great. And it's really nice to see a framework kind of unpacking these things. I had a question for Amy to start, and then a question for both of you. The question to Amy is, for the Ghana case, it wasn't clear to me what the actual interventions were. So I saw all the different quadrants of what, needing resources, needing institutional arrangements, but to do what, around pollution. And I'm curious where in the framework the actual actions that need to be taken or tested or trialed sit. And along with that, I guess I wanted to ask both of you this question is, there seems to be a lot of focus on kind of talking to people about the fact that this is happening. And I'm curious because if somebody came and talked to me and said, you're breathing in all this pollution, it's really bad, I just get very anxious. I mean, I'm not sure what I would be able to do about it. And so I'm curious when these kinds of campaigns that go around telling people that they're experiencing all these health problems based on this big kind of climate change, what is your feelings about how that should be targeted? Is it ethical? Is it scary to tell people that they're, to have these broad-based campaigns? And if so,
We know it's not ethical to tell the truth.
I mean, how do we think beyond just sort of awareness, awareness questions and towards action questions?
Should we take a few questions and then do you want to come in and take a few and then we'll...
Okay, thank you for...
Why don't you introduce yourselves? Because not everybody knows everybody. Liza, go back.
Sorry, Liza, African Center for Cities.
Okay, I'm Darlington with ACDI. Okay, just for me, yeah, my question is a little bit related to what she talking about, but I just had how do you apply the framework in a context which is very, where the subjects are a little bit highly mobile and very dynamic. I'm talking in the context of South Africa and Cape Town, for example, where you have to moving into informal settlements and out or within, and yeah, it's quite very fluid and complex. How do you apply that in that context? Yeah, thanks.
Thank you. Very interesting question.
Hi, I'm Rachel. I'm from the University of Bristol, but visiting CSEC at the moment. Thank you. It's so nice to hear these positive examples and the kind of different elements that contribute to them. And I was wondering, with those cases, do you find, is there like a kind of trigger or a leader that like initiates this, that can be identified? Because I guess thinking about like how you could apply it to other places, but of course you need all of this, but is there something that starts?
Start and then you come in on specifics. And then we can take another round if there are. And we are watching online if anybody wants to put their
We do
forward.
have one in the chat box, but.
Excellent. Okay. Great. Just before we come back to the specifics, and there are important specific scale ethics actually, and what issues do you identify? Just to say that one of the reasons for saying it was helpful to sit back and say, if you're trying to think about the nature of urban health in something that is more than just a project way, in other words, that it's, and in fact, probably even more than a programmatic way, something that is more systemic, that it was very important to acknowledge some of the lessons that had been learnt about things like participation and co-production. But it was fundamental to also ensure that there was an emphasis on much more substantive, harder, difficult to get to things like resource questions and data and information. And then that scaling question really was the one of kind of, well, does it then stop at just at that level and can you scale it up? So the framework was simply, at least initially, was a stimulus to say, if you are serious about doing urban health at scale, which presumably if you are a climate scientist interested in cities, you would be, whether you're talking about heat stresses or pollution or whatever it is that your entry point in is, what does that mean? And what kind of analysis do you need? And so that was the logic behind the framework. As I think your question is quite a provocative one. And I mean, I really take that. I mean, it's a very useful thing because I do think one of the things we don't think about in prioritizing is what is the state of public consciousness or public awareness to begin with. In other words, we've talked a lot about participation, but we haven't talked about local knowledge or general kind of understanding of where issues are. And I need to think about it more carefully and then come back to it. But maybe Amy's got a better sense and can respond more specifically. I can come back on the scale one if you want to, but go ahead.
Sure. Thanks, Liza. Yeah, it's a very interesting question. I think around the ethical question of like how much do you tell the public or scare them into action? The thing is, if science has also established these links, it kind of is, it needs to be known. One of the examples is if the public are eating particular types of food, or the influence that sort of sugar and things like that had like crept into society, and that awareness around like fast food and things like that. So there are other examples where it has been communicated quite importantly. Tobacco has also been a big thing. Alcohol use is a big risk factor. So air pollution is starting to be recognized as another big factor that does underlie a lot of health concerns. I think the reason for action is that the air pollution can also be linked to the tobacco stuff, and also indoor air pollution. So if people are cooking indoors with a lot of sort of carcinogenic stuff, that is in their space in which they can control. But in terms of like, yeah, a city, I'm pretty much at the mercy of my government. Like, if you're walking outside breathing in poisonous fumes. So yeah, but there is a way in which sort of this local consciousness can drive advocacy and tell local governments that actually things need to be changed.
Congratulations.
Oh, the trigger.
Yeah.
Yes. So I must admit, it's very difficult to figure out as an outsider where the trigger points are, because I think a lot of conversations, even within government, happen behind closed doors, and we don't understand what the actual trigger points of things were. Money is a big trigger point. If you get international funding, or and I mean, Accra was, the WHO needed willing cities to be a part of it, and I don't know. In this case, for me personally, other people might have a little bit more of an idea what the trigger point is, but the WHO partnered with Accra in establishing this sort of plan and process as part of the Urban Health Initiative. So I think that created a lot of awareness, but the Ghana has always been involved even before that in air pollution stuff. So I think there was a environment already able to absorb that type of thing. I don't know when it actually first occurred, unless you might know, but
To the show program.
yeah.
But I mean, that's just a really, really useful thing. But I think part of what we were trying to do in, don't think frameworks are necessarily the be all and the end all. They mechanisms for holding us to account. And in the context of thinking about intellectual fashions and operational fashions, of which there are, and the urban health world is full of those. You can just go back and you can really see that, from whether it was clean water, or whether it was sanitation, or whether it was trees, whatever it was. And I think, frankly, the climate world is not dissimilar. Part of what we were trying to say here is, even if you're following a trigger, air pollution is the current thinking, or heat sensitive cities are the current thinking. When you do that, can you think across multiple modalities which are not driven by a particular ideological moment? So if you go back to the kind of participation stuff, which really dominated, very useful, did it really well, but it was resource blind. And conversely, if you go back to an old positivist era, all it was about the data. And so some of what we're trying to say is that if you are going to actually, one of the advantages of a moment intellectually which identifies complex systems is that it does also allow you to hold a multiplicity of ideological positions relatively simultaneously. Okay, it's as messy as Amy points out, and it doesn't, but it does at least enable you to kind of check across those things to say, am I understanding what does the whole health, climate, urban problem look like at a particular point in time? And just go back to that point about scaling. 5 years ago, the ideological moment was about devolution. Everybody was making the point that unless you were devolving, you were, and health was a classic thing. You've got all these national governments, and in big countries like Nigeria, that's a real problem, right? They haven't a clue what's going on the ground. They're not actually making local interventions. A kind of tree program that you see as a sort of relatively bottom up in Freetown, just almost impossible to execute, and maybe completely inappropriate in a desert context of one or another kind. But part of this logic of innovation is about saying, how do you scale up and how do you scale down? And how does what are kind of global programs, a global program of urban health might mean fundamentally different things in a Singapore, where you can redo your building structures and put in materials that are heat sensitive. But they're not, you can still carry that logic into an informal settlement and begin to think about the materials that you provide or allow for informal settlement check construction. So the scale question is, for us, I think, fundamental to innovation.
Great. We've got some questions online, if you don't mind. So from Shanaz Musa.
Shanaz!
I was wondering if there was any link to food security, and does the data point to any particular impact of urban health initiatives on women, mostly in their role as primary caregivers, and then just for ease of, Davina also says, great presentation, read the stakeholder and partnership engagement. What were the channels used to foster this multi-sectoral participation? And then our last question from Jamai Armin. In the Freetown case study, whilst applying intersectional framework, did you perhaps see that once the trees were planted it increased mental health issues? I am just looking at the local context, and in certain areas, the risk that trees bring include an increase in crime around these trees.
I just want to also, I'm very aware, Gina, did you want to respond?
No, I want to ask a question.
Oh, okay. So the food security thing, so just to be clear that we are just using the framework to make sense of what has been done on the ground. So we weren't involved in these initiatives. So, so I just want to premise that, because I think maybe that second question speaks to that. We don't have a lot of insight into what the actual initiatives, how they came about and things. But the food security question, of course, has a lot of implications with urban health, with climate sensitivities. And I think the women question, I can say for the Freetown case, it's always been a thing to also try and empower women. So there has been some efforts to try and increase the number of opportunities of employment for women and empowering them that way. I do know that, but in terms of the food security aspect, I can't speak further than that. And I don't know if you wanted to.
Yeah, I mean, maybe just to underscore what Amy's just said. So the work that we originally did was for age-friendly cities and communities. So we're wanting to think about, that's one of, if you are in the UN kind of world, they have these things called major groups. And probably the most effective major group, surprise, surprise, is the elderly. They've got lots of time, they've got lots of capacity, and they've been really effective. And we have an aging population. And they've had a really interesting health program, and they were wanting to think about what it meant at the city scale. And so part of the push of the framework was to say, don't just think about all these partnerships and programs, which is what they're really good at. They're really, really good at networking and organizing. But you've also got to think about the money. You've also got to think about the data. You've also got to think about scaling and innovation. So that's where the thinking comes from. And we think it's part of what we're suggesting to you as climate scientists, but it would relate to whether it was food or anything else, is when you get substantive about the governance question in ways that are not born out of a single theoretical framing, it does push you, because cities are such complex entities and such dynamic processes, it forces you to think in multiple kinds of ways. So, you know, the interoperability of data is absolutely fundamental, and it's possible. But it's only possible to go to the question of scale if you downscale and upscale. Amy's point about it is quite useful if, a little bit like in the GTOS work, there's some consistency of what is measured where and what is meant by what is measured. That's helpful, not essential, but helpful. It's really helpful. The Beijing Conference of Women was so important in delivering gender disaggregated statistics. And that's fundamental to any health analysis of any kind. So sex, gender, we can debate what we mean, but we've got a conceptual understanding of that notion of the social disaggregation and the spatial disaggregation. So that's some of what we're kind of pushing for here. And it does raise that question about responsibility of who is responsible Okay, and Liza, that's why your question was so provoking, because I think implicitly we would have to acknowledge that James, Amy, and I had a very state-centric understanding and a community-centric understanding, and are not nearly as good at understanding the big corporates, the big media structures and systems, maybe even some of the big cultural structures and processes, and perhaps that needs some rethinking.
But I saw industry was there.
Industry's there, and of course industry is crucial. You know, data management is absolutely fundamental. The banks are absolutely essential to any of this kind of thinking, but it probably goes beyond our conventional sort of understanding of that at all. So yeah, I think we probably lost something of the food. Yeah, I mean, I suppose I would say the food, I don't see why you couldn't use this as a food governance lens, an urban food governance lens, an urban food climate health governance lens. It's simply, in a way, it's speaking back to the governance people to say, be a bit more specific.
But yeah, so maybe on that, so if you can go to your framework slide again, the first one, because I guess that's what I was reflecting on, like actually it's very useful to look at this. And before you put on those 4 squares, I mean, I was looking that the only word there specific to health was the word disease.
Yeah.
And that actually this is a framework for how we need to be working with these complex issues. And I was like, address multiple climate impacts or urban climate hazards. Because this is the space that we're trying to move towards. I think we've made less progress in the urban adaptation on the scaling up innovation and reform. You know, the other 3, I think we're kind of making progress, but it also, to me, spoke to the governance and the challenge we have in cities that are siloed, and that you need often these ways of moving beyond that. So, for example, in the health stuff, my second question was like, where did the Amali program actually come in? I know you've looked at past stuff, so how did that help shift thinking and understanding? Because part of what we want to see is mayors who are understanding the complexity of governance, working across the departments, etc. So it's exciting, but challenging given the structures that we have.
I mean, I think I can just jump in with the Amali thing. I think, if anything, Amali has given us insight into the complexities of mayors trying to get their legacy goals to actually churn and to work out. Actually, Yvonne Kisoya, the mayor of Freetown, is one of our Amali mayors. And I think the reason why it's getting so much traction is she's owned it as a legacy goal of her trying to transform her city and do the, you know, Freetown, the tree town, and there's there's a huge ownership that comes and being able to be the political champion at the face. But in terms of a deep understanding, I think that was able to be pulled to help configure some of this. And it would be nice to see if we can maybe pull this framework, use this framework as a lens to look at the various different Amali cities and how they've managed to get things to work.
I think we've got one more question and then 2 more questions. But I am aware that we're over time, so take that as you will. But back there and then Mark.
Maybe more of a thought than a question, but just tying what was just being discussed now. Sorry, Robert Raw, I'm a climate finance specialist working in adaptation. And when we look at these, the framework is great, but what I often find is missing, like when I look at the Accra example, for example, is the linking with the climate attribution of climate from an adaptation perspective. And when we talk about pollution, air pollution, of course, very clear link with health. But then when you try and start, like I work in climate finance, and if we go to a climate finance person talking about air pollution, they'll come back and say, climate change isn't to blame for air pollution. It's the other way around. Air pollution is causing climate change. We're not going to give you finance. But there's still links. But then that goes beyond to multiple different sectors, to the water sector. All the way down, you've got washers critical for health, but then washers reliant on water, which is vital, ecosystems, which are all impacted by climate change across the whole spectrum. Food and food security, all of that comes into nutritional security as well, tying in nutritional security. So all these sectors are really linked, and I think what's often missing in these initiatives, and what we try to often bring into the projects, in fact, development projects, is shifting to the mindset of people to really think about all these connections. And I'll just, yeah, wondering what, I'm currently working on a health project. It's not in Africa, it's in Iraq, but it's really difficult to find solid data, solid information for that, like the observations, analysis side of it, the resources, in terms of what is actually being done from linking climate and the impacts of climate change and how that's going to get worse in the future to what's happening in the health sector. That link is missing in so much, and I'm just interested to know but maybe there's more that I can look into because I'm interested in the subject.
Cool.
Quickly, sorry to keep recording. So in the last IPCC report, we had a section in our chapter on we call it catalyzing and enabling conditions. And I can see for adaptation, it's kind of everything fits in there. And so I think your framework is quite generic and transferable. I had a question around, I get the feeling that a lot of this city's work is a bit like conservation. You conserve the rhino, but you forget about all the small animals. And so I'm wondering how this plays out in secondary city, smaller urban spaces, and does the balance here shift because you're moving into maybe slightly less complex systems, but also maybe it's harder to get finance and the capacities are different. So is this generic enough for, I guess, across urban scales?
No, I think, so for me, if you had to say where, and Robert, maybe this speaks a little bit to kind of where do these things land and when are they analytically useful? Okay, and there are multiple of them. But for me, it would be a case of if you had a chapter in your national urban policy on climate, we had a chapter in your national urban policy on health, what should it include? Okay, and if all it included was a discussion about health in your major metropolitan areas, it would have failed. Okay. If it didn't have a fiscal analysis, it would fail. If it didn't begin to deal with the question of attribution on particular diseases or for particular sectors, then I think that you begin to work. And, we haven't gone down this track or tried to develop literally, methods for application. I think what we really were trying to do was to say, in a context of a discourse of One Health, of planetary health, how do you center the governance question? In other words, how do you do more than simply take national statistics and go back to the social determinants of health and say there are other institutional actors, there are other processes at work? And I think this is some of the effort to kind of pull through those sorts of discussions. And I think it's very similar in the context of the climate literature. Once you get beyond the big climate funding pools and you begin to start thinking about kind of, okay, so how would you design a climate support program? Where would you put your effort? What we discovered was that most of the effort in the age-friendly stuff happened in all the partnership stuff. Really easy. It's easy to fund, it's easy to demonstrate, really difficult to put it into the resource stuff, particularly into some of what we might think of as educational work, where you think about new curricula. It's really difficult to put it into the innovation space of what is it that scales? Okay, and Mark, that's your question, Mark, does it scale up or scale down? And that's about going for often into a national department to say, does this work in the smaller towns? Does this work in towns that are changing rapidly? Does this work in the poorest parts of the city? And so I think it's not a question of saying you must have all of these things ticked, but if you are about to be implementing a program or you are asking analytical questions about something and you're not asking something from each of those quadrants, probably you haven't got four wheels in the car and it's going to be a little unbalanced. That's not really saying much more than that. It's not a rigid kind of operational frame in that way. We were though, delighted to begin to see WHO saying, yeah, this does help us get beyond the project and the program and to think much more systematically about those institutions that are really important, which is ultimately what governance is about.